Hi, I'm Dr. Mache Seibel, founder of My Menopause Magazine, and I want to talk to you about one of the most common problems that you asked me about, and that is problems to do with difficulties controlling your bladder. Now, a lot of times women are embarrassed to talk about this problem, and it's understandable. I mean, who wants to talk about leaky urine and things like that? But the fact of the matter is because it's so embarrassing, the average woman waits between 5 and 7 years to ask her healthcare provider any information about this common problem. And of course, what that does is it just makes it last that much longer before you get help. The second thing I want to mention to you is the fact that a lot of times women have been under the impression that there's, one, nothing you can do about it, or two, that in order to treat it, it's going to require a great big operation. Well, that may have been true maybe 10 or 20 years ago, but it's not true today. So I want to share some common things with you that will help you as you try to deal with issues related to bladder control. Now, the fact of the matter is that it's so common. As a matter of fact, about 1 in 5 women that are approaching menopause are going to have a problem with a leaky bladder or with incontinence, and about 50 to 80% of women are going to have a problem with it as they get older into their 60s, 70s, and 80s. So this is a really common problem. And you don't have to live this way. It's the kind of thing that if you just address it, so much can be done. So let me talk about it to you in terms of some of the things to think about, because basically when it comes to problems with your bladder, they usually divide themselves into 2 categories. The first we're going to call problems to do with stress incontinence. Now, stress incontinence is an issue where you lose urine when you cough or you sneeze or you pick up your children or your grandchildren or you play in sports and things like that. So you do an activity and there's leakage of urine. That's stress incontinence. And this is a big problem. And a lot of times it has to do with the tissues around the bladder that have actually weakened as a result of having children, but it could occur for other reasons as well. Now, what do you do about that? Well, the first thing you do about it is tell your doctor about it, because there's a lot that can be done. And the thing about it is first they're going to find out the diagnosis. So here's what's going to happen. When you go to the doctor, you may find that your doctor is very versed in these ways and can help you a lot. But if not, there are urogynecologists, and these are either surgeons or obstetricians that have taken another 3 years of training, and they have a subspecialty in this area of urogynecology, and they're particularly well versed. There are other people who can help you a lot as well, but if you don't get help from the person that you see, look for a urogynecologist. Now, in the office, what they will do is they're going to try and figure out what's your problem. And here's how they go about it. They're going to, first of all, take a good history, and they're going to do an exam, kind of like the kind you have every year for a GYN exam. And then what they're going to do is they're going to try to understand where the problem is. So in order to do that, they may put in a little catheter, a little tube into the bladder, and they're going to fill your bladder up with some saline water. And what that's going to do is make your bladder full, and then they're going to try and do something that could embarrass you a little bit, but don't let it. They're going to try and make you lose your urine. So they're going to ask you to cough or sneeze or jump up and down or laugh or press down, and they're going to do things to try and see where the leakage comes from and what happens. Now, when that happens, they're then going to have you go back into the bathroom, and they're going to have you sit in the toilet, and in the toilet is a little bitty container underneath, and when you go to the bathroom and urinate, it's going to measure how much urine comes out. So they're going to know what they put in, they're going to see where you lost the urine, and they're going to know how much urine is left in your bladder. So that's going to give them the basic information that they need to help you get treatment. Now, the treatment for this kind of problem, the stress incontinence begins with totally non-invasive stuff. They're going to send you to somebody who does what they call physical therapy for the pelvic muscles. And when that happens, what they're going to do is help you train those muscles specifically to be stronger and to better control the urine loss, and that may end up being all you need. Matter of fact, often that's all that's needed. But if it's not, then you may need surgery. But if you need surgery, this is what I want to tell you. The surgery has been transformed in the last decade. So much better today. How do you do the surgery today? Well, instead of a big operation where they make an incision in your abdomen, or they make an incision along the entire wall of the vagina and strengthen the muscles and pull them together and all of that, that's not necessary anymore. They do a procedure called a mid-urethral sling. Now let me just tell you what that is briefly. The bladder, of course, is right down in your pelvis. That's where the urine is. And then there's this little tube, the urethra, that comes from the bladder. And that's what the urine comes through. And that is where the sling is done. So basically, the urethra is at the top of the vagina. And it's about 2 inches long. That's about that long. And about midway down it, they put a little bitty cut, a little nick. And then they put some mesh. It's a new kind of mesh. It's not the kind that you might have heard about that causes problems. They have very few problems with this. And in less than about a half an hour, they can actually put the mesh underneath the urethra and lift it back up and then suspend it through some minor things that can be done through the vaginal canal. This has revolutionized things in terms of stress incontinence, and my urogynecology colleagues tell me that you can expect to get somewhere in the order of 80 to 90% improvement and long-term benefits from this. So people come back and they're saying, can't believe I waited so long. So that's pretty much stress incontinence. The second kind of incontinence is one that's called urgency or frequency. And I'm sure that you or someone you know has suffered from this kind of problem because A, it's so common, and B, you know the kind of person, your friends, your daughter, your mother, your sister, or you, who goes to the mall, you know where every bathroom is, you take a trip to visit someone, you know where all the gas stations are that have the bathrooms, you can't hold long enough. And that sometimes leads to loss of urine. That can be really embarrassing. So that's a totally different kind of treatment. And understand that while these two things are totally separate, often they are in the same person. So maybe not just one or the other. So urge incontinence is the one, and this stress incontinence is the other. Now for that, you may find that all you have to do is change some of the foods you eat. That could be enough to do it. By far the biggest offender is caffeine, but you know, you may find that acidic foods are a problem, things that lower the pH in your bladder and irritate it more. Cigarettes, big problem. Nicotine is a stimulant to the bladder. Stay away from that. Things that have sugary drinks, artificial sweeteners. These are things like sodas with their acidity and with their artificial sweeteners. Those are problems, but other foods as well. And also those spicy foods that are really those hot ones, the one with the chili pepper on the side of the menu, those are the ones you want to avoid. And realize that the caffeine almost affects everyone, and cigarettes affects almost everyone. These other ones affect a lot of people, but not everyone. So some of you will find, you may find that you do a lot better if you avoid one than another, and you may find that one of them doesn't change very much your symptoms. So first, work on those things. The second thing that you can do is there are a number of kinds of therapy that can be done in the doctor's office with people who do special techniques that stimulate and re-educate the bladder in such a way that you have more control. And basically, they're going to teach you how to do exercises and how to do things that are going to make things a whole lot better. So that is a very important thing. Finally, there is a new operation that has come available in the recent past for this particular problem. And it involves actually putting a minor procedure done by putting a little nerve stimulator, kind of like a pacemaker. You know, when the person has an irregular heartbeat, they put a little external device, a little battery stimulator that actually tells the heart to beat in a certain rhythm. Well, the bladder is also a muscle, and because of this problem, it's squeezing off at the wrong time, going too quickly, and making you go to the bathroom. So there's an operation that's now available with a device they can put in, and if the other things don't work, this is done in the hospital. The first operation takes about maybe an hour, something like that, and then about 2 weeks later you come back for a second part to it, and that takes about a half hour. And while these are more involved for the surgeon, for you it's a pretty quick recovery and something that can definitely be done. If you find that the changing your diet doesn't help, and you find that some of the behavioral things that they teach you to do and some of the stimulation techniques that they teach you to do and help you with are not working, there's always medications. And as a matter of fact, there are a wide range of medications available now to help with an overactive bladder. And each of these works a little bit different. They're in several categories of medication, and some of them have minor side effects, some others. Some will mix with some of your medicines, some won't. So you need to talk with your doctor about medications, but clearly, before going to any kind of a surgical procedure or anything like that, try the medications because they can help an awful lot of people. Well, there you have it. It's a quick overview, but it tells you the things that can be done. And so I want to once again re-emphasize the point that incontinence, loss of urine, and loss of urine control are common things affecting between 20 and 50% of women, or even more. There is no reason for you to have to wait for 5 to 7 years to do something about it, because there are treatments out there that are new and they are effective. And finally, if you talk to your doctor about this and he or she isn't comfortable talking about this or isn't well versed in some of the things I've talked about and can give you more information so you understand it exactly, ask to see a urogynecologist or look one up that's near you, and you're going to find that very helpful.